Hi, my name is Evelyn or Ariela,
Hi, my name is Ismhael.
and today we're going to talk about papillary thyroid carcinoma or cancer.
Papillary thyroid cancer, or PTC, is the most common type of thyroid cancer, making up about 80% of cases. It starts in the follicular cells of the thyroid gland, which produces hormones that control metabolism. PTC tends to grow slowly, and in most cases, the prognosis is favorable and survival rates are high.
So in this image you can see the thyroid, which is a butterfly-shaped organ, which is part of the endocrine system, and you can see that there's cancer all around the thyroid, which are those yellow nodules you can see that are spread all throughout the thyroid. So this thyroid has cancer. Papillary thyroid carcinoma is a type of cancer located in the thyroid. So the thyroid is a gland that is located at the base of the neck. So right over here is the thyroid, and it's butterfly-shaped. So the thyroid is a really important organ of the endocrine system. And specifically, the thyroid helps with many different functions, including regulating metabolism, heart rate, and body temperature, as well as other functions. The direct cause for PTC hasn't been determined yet, but some of the risk factors include radiation exposure, genetic mutations, and family history of having PTC. Some of the genetic mutations that are most likely associated with PTC are the Gardner syndrome. So this is a rare hereditary disorder in which a person develops several precancerous polyps in their large intestine, particularly their colon and their rectum, in addition to having an increased risk of developing tumors in other areas such as the thyroid. Another syndrome is the Cowden syndrome. So this disorder is caused by a mutation in the PTEN gene. So this is a significant gene that acts as a tumor suppressor, which means it controls cell growth and division, which is a problem when cancer occurs. So as this disorder is characterized by having multiple hamartomas, which are benign tumor-like growth, benign meaning that they aren't dangerous, but it's already becoming a tumor, and an increased risk of breast, thyroid, and other cancers. Here is a summarized version of the risk factors of thyroid cancer, which some of these are exposure to high levels of radiation, hereditary conditions or genetic conditions, being older than 40 years old, being a female, having a history of benign thyroid nodules, and a lack of iodine diet. In addition to this one is being overweight or obese.
Symptoms of PTC are a painless lump in the neck or throat, neck swelling, difficulty swallowing or breathing, but this is more in advanced cases, changes in your voice, and in rare cases, neck pain. These are symptoms for thyroid cancer: swollen neck lymph nodes, a painless lump in the neck, persistent hoarseness, difficulty swallowing or breathing, neck or throat pain, and persistent coughing. PTC is diagnosed. PTC is diagnosed with a physical exam. Your doctor might feel lumps in your neck. It is diagnosed with an ultrasound, CT scan, or MRI. It is also diagnosed with a biopsy. A fine needle aspiration biopsy is also used to collect cells. These cells are studied in the lab. And blood tests to check thyroid function. Thyroid disease diagnosis. Physical exam. The doctor might try to find for a lump in the neck. Blood test. These test the thyroid stimulating hormone TSH levels and T3 and T4 levels. Thyroid ultrasound. Ultrasound uses sound waves to create thyroid gland images. CT or MRI scans. Radioactive iodine uptake. These can be used for diagnosis and treatment. Fine needle aspiration biopsy. In cases of suspicious thyroid nodules or potential cancer, FNA biopsy extracts a sample for laboratory analysis. This shows how the doctor using an ultrasound to diagnose papillary thyroid cancer.
So now I'm going to talk about the treatment for this type of cancer. So PTC isn't as severe or aggressive as other types of cancers. So this treatment also depends on how severe it is. Since it tends to not be as severe, the treatment goes as following. So either total or partial thyroidectomy, which means that either the entire thyroid is removed or part of the thyroid is removed based on the severity of it. So based on this, if it's either all removed, then a person needs to still produce those hormones that the thyroid used to produce, because these hormones are really important in our metabolism and other body functions. So since a person doesn't have their thyroid anymore because they got it removed, they need to supplement these hormones with artificial hormones or synthetic hormones. One of the most common ones is levothyroxine, which is given daily so the person can still do all their daily activities and still live a normal life while having a synthetic hormone. And another type, if it's total thyroidectomy, then they would also need to get radioactive iodine therapy, which is after the surgery. Since they remove the entire thyroid, they also need to remove and kill any of the remaining thyroid cells and cancer cells. So a doctor will usually do this to ensure that they can easily detect if any new cancer comes up. So they remove the entire thyroid cells and also cancer cells with this therapy. So also chemotherapy isn't usually used with this type of cancer, PTC, as chemotherapy is for more aggressive types of cancer, and usually PTC cases don't tend to get as severe to need chemotherapy. So now, with this diagram, we're going to talk about the treatment options for thyroid cancer. Some of these are surgery, radioactive iodine, radiotherapy, hormone therapy, targeted therapy, and chemotherapy in severe cases. Now discussing thyroidectomy. So thyroidectomy is when either the total or partial thyroid is removed. So on the left side diagram, you can see that there's a thyroid gland and only one of the lobes, the left side lobe, has cancer. So then in the middle diagram, you can see that half of the thyroid, only one lobe was removed, the one that had cancer. And then on the right side diagram, you can see that there was a total remover of the thyroid gland. This was probably because the entire thyroid had cancer, not only just one lobe. So in this diagram, you can see that thyroidectomy was performed because one lobe of the thyroid was removed, and a person can live their life normally with only one lobe or even the entire thyroid removed because they will need to get synthetic hormones daily, which is usually levothyroxine. This illustration is about the radioactive iodine therapy. So this is after usually a person got a total thyroidectomy, meaning their entire thyroid was removed. Then they will need to get this therapy so they can kill any of the remaining thyroid tissue cells and cancer cells.
So now I'm going to talk about the prognosis, or in other words, the outlook of this cancer. The good news is that PTC usually has a really good prognosis, especially for people under the age of 55 years old. The survival rate is around 98% for early stage cases, and even for more advanced ones, it's still treatable. While PTC can come back in some cases, it's often manageable if treated properly. So what's next after treatment? After treatment, you'll need regular follow-ups, including blood tests to check thyroid levels and ensure no cancer is hiding, and ultrasounds to keep track on any new growth.
So now I'm going to talk about the prevention for PTC, papillary thyroid carcinoma, or cancer. So there are ways you can reduce it, such as by limiting their radiation exposure. For example, when someone goes to get like an X-ray of their arm or any like body part, if they're obviously not going to get their whole body in radiation, they could use a lead apron, which is provided by the medical office, and this will limit the radiation exposure to unnecessary body parts. In addition, eating a balanced and healthy diet also helps to contribute with many vitamins and minerals that a body needs to prevent any cancers from forming. In addition to daily exercise and taking out stress, and it all helps to prevent cancers, especially PTC. This illustration shows what to do to prevent PTC. These would be asking for a thyroid collar for x-rays to prevent the radiation from getting into your thyroids, and also eating less soy, quitting smoking, and consider supplements. So this illustration shows all the good foods for the thyroid, which would be the nuts, lean meats, eggs, probiotic-rich foods such as milk and yogurt, lemon, walnuts, and honey, wild-caught fish, shellfish and seaweed, coconut oil, vegetables, kidney beans and navy beans, fruits, orange juice, pumpkin seeds, and sunflower seeds, which will all benefit your thyroid and even your entire body systems.
These foods are bad for thyroids: fluoridated water, caffeine, alcohol, fast foods, carbonated soft drinks, food containing sugar, refined vegetable oils, processed meat products, refined sugar, gluten-containing foods, soy foods, and raw cruciferous vegetables.
I also wanted to add that, as I previously said, the genetic mutations in one's body could also lead to PTC. It doesn't necessarily mean that just because someone has a genetic mutation, then they will get like PTC. Because there has been research that has shown that people with genetic mutations and illnesses has actually been dormant, and after their autopsy, it has been revealed they even had cancer, but it became dormant their whole life. So there are ways you can prevent it and have even a genetic mutation or even cancer dormant your entire life, such as by the prevention methods I described earlier, eating healthy, doing exercise, and living stress-free. I hope you found this video useful as we try to summarize all the main points of PTC as short as possible to make this video quick for you so you can learn.
Thank you for watching us on how we explain what PTC is. God bless you. Have a nice day. Bye.
Bye.
Don't worry about anything. Instead, pray about everything. Tell God what you need and thank you for all He has done. Philippines 4:6.